Today we're going to talk about a skin problem that is very different from acne pimples. Most patients feel it is an acne pimple, they take all acne pimple treatment and get no relief. This is very different from acne pimple, and the acne pimple treatment will not work over here. It is very important to identify what this problem really is and have a very specific approach towards this particular disease. It is very important to know that how would you differentiate between acne pimple and this particular condition, and how would you treat this in a Ayurveda way to get lifelong results. Why do most patients take acne pimple treatment and don't get relief? They have the same intensity of the acne pimple, because it's very important to understand what the condition really is. Every single pustule that you have over your face may not be Yavan Pidika or acne pimple. Let's understand what this condition is and why and how Ayurveda cures the root cause of this condition. And I will also be sharing certain tips and home remedies that you can use, and you will definitely get the results in the first week itself. So keep watching, we'll be back. Namaste everyone, welcome to Jyovis Hospital of Ayurveda and Aesthetic Center, Mumbai. We're talking about fungal acne. Fungal acne, also called as Malassezia folliculitis. It is called as fungal acne because most patients misdiagnose or feel that it is acne, but this is not acne at all. Acne and fungal acne, these are two different conditions. Any treatment for acne you take in the modern science, the fungal acne will never be cured. In fact, the fungal acne, it always keeps on reoccurring, coming back again and again, and hence we can also say that even fungal acne doesn't really have a permanent or foolproof every patient 100% result. We don't see that. Why and how Ayurveda has the answers, why and how Ayurveda in over 50 plus countries we see 100% results, especially for such Shudra Rogas, minor infection like fungal infections or fungal acne, we'll understand in this particular video. Before that, let's understand about Malassezia folliculitis. This looks like acne, but it is different because the papules, pustules are of uniform size. They mostly occur over the cheeks and chin, whereas acne, it is mostly seen in the T-zone. Over here, these pits that are there over the face, they look like acne, but they have itching. Acne pimple skin, it has sensitivity, but here the papules, the pustules are very much itchy. So any itchy infections, the approach should go towards the skin infections, towards dermatology, and not just a cosmetic or aesthetic problem over here. So very important to know that Malassezia is a yeast, and over here, unless and until we don't have a permanent fungal infection treatment which is not reoccurring, no failure, no relapse, permanent result, the patient will not come out. The patient may get some relief with the fluconazole, itraconazole and over-the-counter medication which every patient has taken in their life, but we need to have a permanent approach, not just when the medicines are stopped, the disease coming back again. We need step-by-step approach, but good results overall in the overall fungal infection. This Malassezia is not just seen over the face, but it is seen over the face, neck, chest, back, hands, multiple different areas. So very important to treat the fungal infection over here, to firstly understand what is Malassezia and treat it accordingly. As per Ayurveda, it is said as Kushta, which means skin diseases. While explaining skin diseases, our acharyas say Kushnati Vapu, which means the skin that is worsening, that is damaged, jo sad gayi hai twacha, that is called as Kushta, which is skin disease. Mahakushta, Shudra Kushta. Shudra Kushta, which is a category of minor skin infection, and in this category there is one condition which is called as Dadru Kushta. Dadru, D-A-D-R-U, which means fungal infection. Unless and until we don't give a Dadru Chikitsa, patient does not get any kind of result. Whereas medicines given for bacterial infection will definitely not work for fungal. The medicines given for fungal have temporary results in maximum cases. So over here, as per Dadru Chikitsa, it is said that one must balance the kapha, one must balance the pitta, and one must detoxify or treat the vitiated Rakta Dhatu. So kapha, pitta and Rakta, their treatment over here is very, very important. As per Ayurveda, Shodhan, Shaman, Pathya, Pathya. Pathya, Pathya, which means do's and don'ts. We have a specific video on YouTube that talks about the list of foods that are helpful in fungal infection. That's one part. The second important is the Shodhan Karma, which means the Pancha Karma. Whatever doshas are aggravated, remove it out of the body. For an example, for a Kapha, we have Vaman. For Pitta, we have Virechan. For Rakta, there is Rakta Mokshan or Rakta Purifier herbs. Lot of varieties and different protocols where patient in any case gets complete results in Ayurveda, because the treatment modules are so much, the methods are so much, the options are so much, wide range of herbs, wide range of treatment protocols explained in Ayurveda for fungal infection. So fungal infection treatment is important, knowing that it is melissasia and not a normal acne, and treating it accordingly. So Shodhan, which is the Panchakarma, Shaman, which is certain herbs to normalize the doshas. About Shaman Chikitsa, I'll be talking about certain external applications. Before that, let me talk about the safe and effective formulation. Doctors across the globe have been using this for skin disorders. This is Activate India tablet Tuaximed and tablet Live C Med. Tablet Tuaximed and Live C Med has extracts of the Sariva, Khadir, Manjishta, Vidanga, Devdaru, Kalmek, Brungaraj, Kutki, which are outstanding alkalizers. They are liver detoxifier, Rakta Prasadak, Rakta Pachak, they are Mausa Pachak, and they have overall good results when we see in the cases of fungal infection. Very important over here is to have a 360-degree approach and treat the fungal infection over here. Talking about the home remedy which you all can use, let me explain this to all of you. This is number one ingredient, it's Yashti Madhu. Yashti Madhu is known to fight against the fungal infection. Second is the Sariva, which is a blood purifier. It cleans the vitiated blood. It is also sheath, cool in the property. Many patients may use Manjishta, but Manjishta is Ushna, Sariva is sheath, hence Sariva is more effective here. The third ingredient, very important, this is prepared from the conch shell, a natural alkalizer and a magical ingredient for such kinds of acne pimple cases where pustules are seen. So Yashti Madhu approx 20 to 25 gram, Sariva around 15 to 20 gram, and Shankha Bhasma 10 grams. Make it as a combination, store it in a container, and we need to use a face pack once or twice a day. Mix it with water, 15 to 30 minutes over the face, and we see outstanding results. Due to Shankha Bhasma, due to its natural alkalizing properties, we see that the acne pimple area or the area dries up and we see clean and clear skin step by step. Of course, we do need an internal approach. We do need to treat the fungal. The specific treatment is needed. In some cases, Panchakarma is needed. In some cases, with simple do's and don'ts, here and there combinations, we see outstanding results. Over here, the whole conclusion is melissasia and acne pimple. Yavan Pidika and Dadru Kushta, these are two different disorders and it has to be treated accordingly. A specific treatment for a specific disease is very important. Through Ayurveda, we see within a short period of time, patients get lifelong results. This is all for now. Any doubts, any questions, let us know in the comment section below. Until next time, from Jyovis and the team, look impressive, be progressive.